Hi, I'm Caroline Livingston, and this is Dysphagia and Tracheostomy. In this topic, I want to focus on the risk of developing dysphagia after tracheostomy decannulation in different populations. The populations I'm going to talk about are the patients with severe burns, patients post-stroke, and patients with brain injuries. I'm going to start with some vocabulary. A tracheostomy decannulation is the process of removing the tracheostomy tube when it is no longer needed. Decannulation is only considered if the patient doesn't use a ventilator and can manage their secretions independently. So, the first article I chose is called The Severe Burns Patient with Tracheostomy, Implications for Management of Dysphagia, Dysphonia, and Laryngotracheal Pathology by N. Clayton, P. Kennedy, and P. Mates. The purpose of this study was to investigate the risk of dysphagia, dysphonia, and laryngotracheal pathology in severe burns patients with tracheostomy and following decannulation. Here I have some reasons and complications for tracheostomy. These charts are from the article. Here we have our oral phase and our pharyngeal phase features. As you can see, the pharyngeal phase of swallowing is most affected after decannulation. The next article is called Improved Dysphagia After Decannulation of Tracheostomy in Patients with Brain Injuries by Kim et al. The purpose of this study was to investigate improved dysphagia after decannulation of a tracheostomy in patients with brain injuries. Here we have the inclusion criteria and the factors measured in the study. After decannulation, the researchers noted that they applied dressings to the sites, which may have had a positive effect in restoring subglottic air pressure. One interesting thing about this study was there was no significant differences in pharyngeal transit time after decannulation, suggesting that there is no kinematic effect on the swallowing mechanism. The final article is called Changes in Swallowing and Cough Functions Among Stroke Patients Before and After Tracheostomy Decannulation by M. Park and S. Lee. This study looked at the functional changes in swallowing and voluntary cough before and after decannulation. The participants were divided into two groups, the decannulated and non-decannulated. This chart shows swallowing function before and after decannulation. We have our initial evaluation before decannulation and after decannulation. As you can see, there's not a whole lot of difference between before and after decannulation for swallowing function, but there is a big difference in the voluntary cough. In conclusion, tracheostomy decannulation has mixed effects on swallow function. It really depends on the patient and their circumstances. There definitely is a need for more research in this area, especially with these populations. Thank you.